Today, we're diving into a medical emergency that often hides in plain sight. It's a condition that can go from just feeling a little off to being in a life or death situation in just a matter of hours. We're talking about adrenal crisis. And let's get one thing straight right from the beginning. This isn't a minor issue. Medical sources like stat pearls here spell it out pretty clearly. It is a severe, life-threatening condition. It's a true endocrine emergency where spotting it and acting fast is absolutely everything. So this gets us to the real heart of the problem. You've got this incredibly dangerous condition, and this is the tricky part, it's notoriously difficult to spot, especially in those early stages. Let's get into why that is. Okay, check out this number, 6%. Now, that might not sound huge at first glance, but it's actually terrifying when you know what it represents. This isn't the mortality rate for just anyone. This is the rate for patients who already know they have adrenal insufficiency, people who have been educated about it. It just goes to show you how fast and how brutal a crisis can be, even for people who are supposedly prepared. So why is it so sneaky? Well, because it doesn't start with a bang, it starts with a whisper. The first symptoms are things you could easily brush off. Maybe you think you have the flu or some bad food. We're talking severe weakness, nausea, stomach pain, dizziness. And that's what makes it so dangerous. It tricks people into waiting, delaying the urgent help they desperately need. And that delay, it's critical. Because while the symptoms start off vague, the progression is anything but. It can spiral, and I mean fast, into full-blown shock, which then leads to confusion, unconsciousness, and even coma. The window to do something about it is incredibly small. So what's actually going on inside the body to cause this total system failure? You can think of your body's stress response system like a fire department. When there's an emergency, you need all hands on deck, ready to go. Well, in an adrenal crisis, the fire department has essentially been shut down. And the fire chief in this whole operation is a hormone called cortisol. You've probably heard it called the stress hormone, but honestly, that doesn't even begin to cover it. It's a survival hormone. It keeps your blood pressure stable, it makes sure your brain has fuel, and it keeps inflammation in check when you get sick or hurt. You take that away, and the entire system just collapses. So how does the body just lose its cortisol? Well, there are two main paths. In what's called primary insufficiency, the problem is with the adrenal glands themselves. The factory that makes cortisol is broken. But in secondary insufficiency, the factory is fine, but management, the pituitary gland in the brain, isn't sending the order to produce it. And that's exactly why the most common cause is suddenly stopping long-term steroid meds. It basically tells management to shut down. You see, a person with this underlying condition can be living a perfectly normal life, but then a trigger hits. And the number one trigger by a long shot is something as simple as an infection, a stomach bug, the flu, anything that puts major stress on the body. That stress demands a surge of cortisol that the body just can't make, and that's what pushes them over the edge into crisis. So how do we get from those really fuzzy, vague symptoms to the hard evidence? What are the actual red flags, the diagnostic clues that should be setting off alarm bells for everyone involved? If you only remember one thing from this whole explainer, please make it this. In an emergency room, when a patient has dangerously low blood pressure, the first thing you do is pump them full of IV fluids and give them drugs called vasopressors to bring it back up. When you do all of that and their blood pressure still won't budge, that is a gigantic flashing red light for an adrenal crisis. Then the blood work comes back and usually paints a very clear picture. You see this classic triad of findings. You have the low blood pressure from the lack of cortisol, but you also get low sodium and high potassium in the blood. And that's because another key adrenal hormone, aldosterone, which is in charge of your body's salt and water balance, is also missing in action. Okay, so the signs are there, the suspicion is high. What has to happen next is a flat-out race against the clock. The emergency response needs to be fast, it needs to be aggressive, and it needs to be right. The treatment plan really comes down to three non-negotiable pillars. Number one, hit them with aggressive IV fluids to fight that shock. Number two, and this is the big one, the lifesaver, give them IV steroids, specifically hydrocortisone, right away. You're literally replacing the hormone that's missing. And number three, at the same time, you have to fix that low blood sugar and those out-of-whack electrolytes. And this quote right here, this is the golden rule. Every single medical guideline says the exact same thing. If you even think it might be an adrenal crisis, you treat it. You give the steroids immediately. You do not wait for a lab test to come back and prove you're right, because that delay could be fatal. You just treat. So once the patient is stable and out of immediate danger, the whole game changes. The focus shifts from emergency response to prevention. How do you live with this condition and make sure this crisis never, ever happens again? The most important part of that plan is something called the sick day rules. It's a simple concept. When a patient with this condition gets sick, say with a fever or the flu, their body's demand for cortisol skyrockets. So they have to be taught to double or sometimes even triple their daily steroid pill dose to copy what a healthy body would do naturally. It's all about preventing the crisis before it can start. And it's not just about knowing the rules. It's about having the right gear. Every patient needs a safety toolkit. We're talking a medical alert bracelet that can speak for them when they can't, an emergency injection kit with a shot of hydrocortisone that they or a loved one can give in an instant, and a steroid emergency card that tells any doctor or nurse who's unfamiliar with the condition exactly what needs to be done. So, we'll end on this question. Adrenal crisis is really a perfect storm. It has these vague symptoms, it causes a shockingly rapid decline, and it requires a very specific life-saving treatment. Knowing how to spot those red flags, especially that stubborn low blood pressure that just won't get better, isn't just for doctors and nurses. It's knowledge that could, one day, help you save someone's life.